2, 1, live.
Hey everybody, it's Dr. David. Welcome to another Ask Dr. David live video. It's so nice to be able to connect with everybody. For those who don't know, I am a board certified pediatrician in Tampa, Florida, and I focus on functional medicine. Today, we're going to be fielding questions from people. We first allow for people who are our Patreon members and subscribers from our social media, and then we open it up to everybody else. And if you haven't submitted a question and you wish to do so, since we're doing this all live, please feel free to do so. Now, this is to be understood that this is for general information. We will not be discussing any particular cases, medical cases. And of course, that's something that should be done as part of a medical consultation, which is something we do here for people in the state of Florida. But also, I do educational consultations for people around the country as well as the world who would like to get the kind of information but can't establish as a medical patient of ours here at Holistic Pediatrics and Family Care or Holistic Relief. So, Shari, who is mining the booth, can you hit us up with our first question? And I gotta see where that is actually on here. Why am I not seeing that? There's a chat. Okay. There we go. I had to hit the chat button there. Apparently, that's something that's helpful here if I want to see what she's writing. Okay, and Shari, we are hearing your noises in the background. Okay, well, here's the first question. It's about digestion and parasites. Okay, oh, here we go. Okay, sorry for that. It is my understanding that parasites are very hard to detect. We have read that a parasite cleanse is recommended periodically, as is done in other countries or with pets. For someone with chronic disease issues but no diagnosis, do you think a parasite cleanse might be helpful, even if results for ova and parasite testing were negative? And I'm going to take a quick sip of water before I answer that. Okay. So, first of all, yes, it's true. Parasites are more difficult to identify than a bacteria in particular, but also some viruses, depending on how you look for the virus. Part of that is when we do parasite testing, or what's called ova and parasite testing. Ova are the eggs from the parasites, and obviously looking for the parasites themselves. That is part of the reason why we always do 3 samples. Significantly increases the yield as opposed to just doing one-time sample. But even that, I do find a lot of times when people are using some of the outpatient laboratories that are associated with their insurance, that they're less likely to find something. So I do a much more comprehensive parasitology test that actually goes after looking specifically using PCR for all of the different parasites that are out there. And we're talking about many different types. There are worms, there are flukes, there are one-celled parasites. There's so many different ones that are out there. And of course, they're very, very small, so sometimes that they can be missed. But that to me is important why I do a much more comprehensive test in the first place. Okay. Now, I am not one who believes that all people need to be doing a parasite cleanse. In fact, I don't know that it's something that I know that it's not something that is routinely part of my practice. Now, if a person has healthy, beautiful poops that they're passing at least once a day, no abdominal symptoms, that they're healthy, I don't go looking for parasites in people like that. But when I am working with a patient who maybe has chronically abnormal stools, mucus in their stools, blood in their stools, not formed stools, undigested food particles, etc., that is one of the things I go looking for. And sometimes I will do not just a parasite test, like I mentioned, but a more comprehensive stool analysis. And this allows me to look for the levels of good bacteria, the flora that are supposed to be there, looking for any pathological bacteria, things like Clostridia, Salmonella, all types of things like that, viruses, but also letting me look for fungi. Such as Candida, for instance, which can cause a lot of those types of symptoms. But a parasite test is something that I'm more likely to do, as well as if I've had somebody who has traveled internationally. because there are more parasites that are out there. So that's part of it. And you're mentioned in terms of they do in other countries. And I'm not familiar as to which countries that is. I know that obviously more under developed countries are more likely to have parasites than in more developed countries. So part of a family travel history, that's one of the things I'm asking for. And if someone has abnormal stools and they've been in underdeveloped countries, I'm definitely going to be thinking more about parasites. But as I said, a cleanse is not something that I would normally do. Now, the mention here regarding a person with chronic digestive issues but no diagnosis, of course, that would kind of I would ask the question, well, what type of evaluation was done in the first place? In addition to the stool test that I mentioned, I will also a lot of times do a urine organic test that's looking for substances that are made by yeast or bacteria, but are not made by humans. So if it shows up in the urine, that's another way of finding those pathogens there. But even when it comes to parasites, as I said, there's so many different types of parasites. And I am not familiar of any single treatment that is going to take care of all of those parasites anyway. So, yes, there are certain ingredients like wormwood and black walnut, aloe, that people can be using that I think are safe. There's not really a single parasite product that I go looking for. In fact, I want to know what that parasite is, because then I can know what treatment to use for that particular organism, because of course it'll be different. Um, Okay, do you think the parasites cleanse my okay? All right. So the next question here coming up. Do you recommend any parasite treatments that might be gentle, safe, and effective for kids? Okay, part of the same question. So, as I said, there are kids' versions out there. I haven't seen any research that actually says that what the safe or proper dose is for any of these things, nor, obviously, there's no treatment, as I said, that will go after everything. So, again, using some of those mild ingredients, I think it's fine, but I wouldn't say, hey, there's this one product that I would use over everything else, because I just don't see it that way. Okay. Continuing on the parasite question. Okay, we have a series of questions here. Should the whole family be treated at once? Okay, well, if parasites are found, yeah, I would go ahead and treat everybody so they're not passing it back and forth. The classic for that is like pinworms, right? We know for sure that everybody in the family needs to be treated at once, or they're just going to be passing it from one to the other and it keeps coming back. Of course, there's other things that we want to be doing, such as good hand washing, not sharing linens, not sharing towels, washing all of that in super hot water, as hot as you can get, in order to try to kill and wash off those pathogens, those parasites as well. But yeah, I would certainly, if I was going to, because I found it would certainly make sense to treat everybody at once, just to kind of get rid of it all at once. Okay, next question coming in. What is the most common cause of constipation? Any tips for home constipation relief? When to see a doctor for constipation? Okay, so let me take the first one. What are the most commonly caused sorry, let me start that again. What is the most commonly caused Boy, I'm having some English problems. Maybe I should take another sip of water here. Excuse me. What are the most common causes of constipation? Okay. So, good thing that I drink my water. So, lack of fluids or insufficient fluid intake, and lack of fiber intake. By far, that's the first thing that I do when somebody comes in with constipation. Now, of course, if they're suffering and in pain, I'll do something to try to relieve that. But in terms of my overall approach, I want to make sure that they're getting enough fluid, and I want to make sure that they're getting enough fiber. Now, the amount of both of those do vary based upon how old the person is. Actually, there's even some variability whether a person is male or female. But that's the most important thing. And I can't tell you how many times just that alone is what it takes. Now, the probably the next one after that is a lack of activity. So, obviously when you're moving around, the gut's moving around, your legs are moving around, etc. So, even with babies, when they're constipated, sometimes we'll bicycle their legs to kind of get some action going there. But is a person active? Are they moving things around in their body in order to help things go through? Now, there are sometimes a change in a person's life or lifestyle or travel, something different that may shock the system, even if it's emotionally or whatever, can make a person not be able to pass stools. Maybe they're worried about something, but nonetheless, some kind of change that's often involved as well. Now, of course, there are people who can have acute constipation if it's very severe and painful. People can have blockages, so that's something, but that's usually a doubled over in pain out of, not what you would consider with normal constipation. And another thing that we have, which is more common in children, is stool withholding. Can sometimes happen when when a young child is transitioning from diaper to toilet, and if they're not ready yet, they may assert their will, their authority, if you will, and decide that they're not going to poop. And obviously, that's not something that other people can really dictate for somebody to do. They can encourage them, reward them, all types of things. But if a person's not wanting to poop or ready to poop, they may not be ready. So that's one thing. If a kid is resisting and it's around the time of potty training, don't push it. The kid is probably not ready. Okay. When, if a person, and it's also normal to understand, or it's to understand that in babies, breastfed babies, once they get about 3 to 4 months of age, it's not uncommon for them to pass a poop only once a week. And it can go from like 3 or 4 times a day, especially this is for breastfeeding babies, to all of a sudden going a week without pooping. And that could really freak a parent out, of which I'll then ask questions. Is your kid uncomfortable? No. Okay, well, you may just want to let it ride through. But because breast milk is such a perfect food, there's not a lot of waste product. And breastfed babies, their intestinal lining actually matures much faster to adult like by 6 months of age, whereas a formula fed baby, it goes much later. So that could be that a combination of the world's most perfect food that has no waste product or very little, combined with this more efficient absorption, can lead to constipation. A lot of times in those situations, when we introduce solid foods, purees or whatever, that's often when that goes away. Now, in terms of what types of treatments can we be using at home? Besides what I said, making sure enough fiber, making sure enough fluid is consumed, that's when I start to looking at some fruit intake. Prunes or prune juice. Okay, grape juice, apple juice, sometimes that can help. But one of my more recent and more favorite fruits is kiwi. There was some research that came out back in 2021. There were, I think, 2 different studies that showed that for adult eating 2 kiwis per day actually work better than prunes, better than Miralax, a lot of the other things that were out there. So, there's fiber more that's in the skin. I know it kind of looks weird to think about it, but it doesn't really taste hairy, kind of like eating an apple in terms of the skin, or maybe like a grape because it's softer than an apple. But sometimes the fiber that's there, and that can really help move things along. Sometimes aloe, starting off with an ounce or two, can be helpful as well as for moving things away, moving things along. When to see a doctor for constipation? Well, if those things aren't working. Okay. I mean, and yes, there are over the counter stool softeners and things like that. Things that are not fiber based or fluid based, fruit based, sugar based. Really, it's best to work with a healthcare provider on that. Okay. I use lots of things. Stool softeners like and magnesium. There are also what are called stimulating laxative, things like senna, which you got to be more cautious with, because you can become a little addicted to those because they're kind of stimulating. When you get stopped the stimulation. But certainly if any patient is in significant pain, or it's just gone on long enough and the home remedies are not working, that would certainly be a good time to hit up your friendly medical provider. Okay. All right. So it looks like we have a series of questions coming about pregnancy and supplements. So let's go through them one at a time. What natural remedies are safe to take when you get sick? When you're pregnant, such as supplements to help you with your immune system get better faster. Okay, so one certainly does need to be more cautious when it comes to being pregnancy state. Now, I know I've shared and talked a lot about our immune support protocol. Our patients know that it is found in the patient portal useful info section on our Patreon pages. It's part of the documents there. And all of the supplements that are listed there are fine. The only thing that we do differently is we do not use high dose vitamin A. We use a much smaller dose. We still want to give higher than physiological doses of vitamin A because of its antiviral, anti-inflammatory properties, but we don't go to that mega dosing that I would even do to a 6-month-old. When there's a bun in the oven, I do like to be more cautious, and that's for the baby's sake, not because of the mother's sake. A mother can obviously handle that, but that's really for the most part. Now, other things, so things that are in there, as you probably know, are things like zinc and vitamin C, echinacea or larix, and elderberry. That's certainly a fine thing to do for the immune system as well. And so, yeah, as long as, bowels, when it comes to vitamin C, of course, if you start taking vitamin C and your stool becomes loose, you probably took too much, because it does have that laxative effect on as well. But there are other things that people can do, like for upset tummies, for instance, like a person, ginger can be very helpful. Um, we try not to use too much chamomile tea, which I use a lot in my patients otherwise for upset tummies, because chamomile, there is some concern that it could induce early pregnancy, and so we kind of do stick away from that. But certainly those more basic stuff, those are very, very safe to take. Obviously, it was asked about natural remedies, and of course there's pharmaceutical treatments that sometimes get involved, and so of course asking, do I really need to be doing this? I always caution people, if somebody offers a antibiotic to you, and this is true not just during pregnancy, but all the time, why do you think I have a bacterial infection? Why do you think that this is not viral? Okay, because unfortunately, antibiotics get thrown out there all the time, and we know that antibiotics can disturb a pregnant woman's, as anybody's, but in this case, the pregnant woman's microbiome, her flora. Okay, we know that flora that moms have going through the birth canal is what seeds the baby's intestinal lining to form the good flora of the microbiome there. So taking antibiotics during the pregnancy can disturb that, which is of course why for all purposes, we want to do that. But we want to focus on good intake of fermented cultured foods. The microbiome has such an impact on the inflammatory cells, the cytokines, inflammation within the body itself, and we don't want a pregnant woman to be in a highly inflamed state, because we don't want those to be passing over into the baby as well. So yes, we want to just be a little bit of careful from that perspective. But of course, everything that we do, we should ask ourselves, what's the potential pro versus the potential con compared to any alternatives out there, and we double those thoughts when we're dealing with pregnancy. Next question being loaded up here. There we go. Okay, I'm being asked to stand by, so I will stand by, and hope everybody's doing okay out there. I know that it's been certainly an interesting month. You may have seen some of the other work I'm doing on YouTube, and the videos that I've been putting on TikTok that are more relevant to the moment that I'm trying to put out there. Just really in terms of trying to educate people and share my knowledge with them. Okay. Oh, here we go. When a woman is pregnant, can she take baby aspirin 81 milligrams to prevent miscarriage? My fertility doctor is recommending it for the first trimester. I had 2 early miscarriages at 4 weeks. I'm now almost 8 weeks. I don't want to increase the risk for any neurological issues in the newborn. Okay, you know, baby aspirin is pretty darn safe. Okay. And I really don't have much of a problem. Obviously, we want to use as little medicine as possible. But of course, if there is a hemorrhage or a clot or something, that's obviously not very good for the baby as well. But there's a couple questions that do come up for me. And this is really one of the things when I focus on my preconception work, because this is something that certainly comes up. People have had multiple miscarriages. Obviously, I have families who want to have another child after their first child has autism, and taking some of those approaches as well. But I want to know, why did those miscarriages happen? Okay, there are genetic issues, right? And somebody could have, obviously most babies who have Down syndrome, trisomy 21 survive, but there are other trisomies like trisomy 13 and trisomy 18 that are not compatible with life, and the woman's body would shut that down before progressing too far in the pregnancy. And there's other genetic issues as well. So of course, if I don't know if any gene testing or tissue testing was done. A lot of times that's not done with one or two, but certainly if there are more multiple miscarriages, that's certainly something that can be done, as they can do a genotype and do studies on the tissue itself of the aborted tissue. Now, when it comes to this, though, I'm wanting to know why is the person in this state where they're going to be bleeding more, of course. And there's also issues, or they're clotting, right? Because obviously, if you clot, then you can have hemorrhage, etc. Now, there are two main reasons why that can happen. One of them is genetic. MTHFR being one of them. So, of course, if somebody, especially if they have a C677T MTHFR, or especially a double, being on methylfolate can be super important for them. Okay. But in addition to that, there are other genetic issues, things like a protein C or protein S deficiency, which could be genetic, or it could be functional later on in life. To factor five Leiden, etc. Those are kind of more on the genetic side. But there is also something which is called the antiphospholipid syndrome. This is an autoantibody condition that can affect the platelets and can cause those types of clumpies in the state where a person can have bleeding issues. Okay, there's like the anti lupus coagulant antibody. There's the anti cardiolipin antibody, the anti phospholipid antibodies. We can do IgG, IgM, IgA testing for those. And if that's the case, one of the things that we will commonly use is are shots of like heparin. Okay. And that's something that can be very helpful. And that's something that we will do through the first trimester, or sometimes even into the second trimester or later. So knowing what the reason why is, to me, is an important thing, so you can kind of, again, get more to that root cause type of situation. But something that I very frequently work on, when people do have miscarriages earlier in their pregnancy, probably at 8 weeks, you're probably past this. But another one of the reasons why people can miscarriage is a low amount of progesterone. So progesterone is obviously being made as when the part of a female cycle. Progesterone promotes gestation. That's why they call it progesterone. And it is the hormone that helps the uterine lining thicken. Okay. So the progesterone levels go up, ovulation will happen. And if there's a conception and an implantation into the wall, those progesterone levels are supposed to kind of keep on going up and up like that. If there's not enough progesterone being made, or if, for that matter, if there's not a conception in the first place, then that's when the progesterone dips off, and that's when a woman will have a period, a menses, because that's the sloughing off of the lining of the uterus, because there's no conception. But if there's not enough progesterone in the first place, then the liveliness of the intestinal lining, the blood flow, the nutrients, all that to it, can be compromised, and that can be a problem. So whenever I have a patient who has had miscarriages before, as soon as they find out that they're pregnant, I get a progesterone level. I like to see the levels at least 15 to 20. I also check a beta HCG, which is the hormone that when a person does a pregnancy test, you pee on a stick, that's a beta HCG level. That's just a plus or minus, a positive or negative test. But you can also at labs do a actual level, a quantitative level. That's also important because the level is supposed to like double every couple of days, and that's one of the ways of knowing that you have a healthy pregnancy. Okay, if the number starts going down or tailing off, then there may have been an early miscarriage at that point, or a threatened miscarriage, etc. So, but of course, if a person does have low progesterone, it's an easy prescription to get. Some women will do it as a vaginal insert. Some will take it orally. We would then check the progesterone levels 2 to 3 days later to make sure that the levels have come up. And then we typically stay with that at least to the end of the first trimester. Again, we sometimes go further, but when we do kind of start to take them off of it, we will check a progesterone level before they stop it. But then we'll check another progesterone level a couple of days after they stop it, in order to make sure that the body is maintaining the level on itself. If not, we can always go back on it. It's safe to do. Just don't want to do things that we don't have to do. Now, so that's really the approach that I will take when dealing with this overall. But of course, I know that you're working with a fertility specialist. Of course, you should be working with an expert on this type of thing. I know that some of the things that pretty much all of the stuff I shared for you is actually what I learned from our fertility doctor specialist 20 years ago, before we had our children. And so she opened up. In fact, it was interesting because she said that the first thing that she wanted to do was to check my wife's MTHFR. And at that point, I did not know that had anything to do with fertility whatsoever. I knew in the autism world, and I had learned about it in the heart attack and the cardiac world. And I said, "Well, we don't have a family history of those things. Why do you check that?" And that's when she said, "Oh no, that's one of the most common reasons why a person can have a miscarriage, especially if they have the double C677T." And I was like, "Oh my God, I need to learn a lot from you." And then that she then went on to run all these other stuff up, and she actually became a mentor of mine. She actually would help me through in my early days of knowing what kind of dosings and what to do for these things. In fact, I have patients who even go down to South Florida to this day who will see her because she was just such a rock star for us and so kind. And so, yeah, so that was really, really nice. Dr. Wood down in South Florida and in the Weston area is who we saw. And just, I can't thank her for so much for helping me out and my families, but of course, so all the families out there who I've been able to teach after that. Okay. Next question. Is it safe to have a massage and chiropractic treatment while pregnant? Good question. Okay, so if the person knows what they're doing, so obviously there are certain things, positioning, pressure being put on the body, what kind of, there's during pregnancy, there's even certain types of massage and chiropractic tables that have the bell a space for the belly kind of like carved out, if you will, that the cushioning takes that so the belly can go on there, because obviously you don't want somebody laying right on top of their belly, without having that kind of spacing there, because obviously when there's a massage and manipulating and stuff like that, you're pushing down on that. So that's an important thing right there, is to make sure that the proper table is available. But if one knows, if a provider knows what they're doing, I don't really have an issue with that whatsoever. In fact, I know that women will get benefits, especially later in their pregnancy, as they're carrying all of the weight and that extra pressure on the lower and mid back. And sometimes adjustments can be very helpful there. Of course, same thing with massages when trying to soften up those muscles, because we know that so often pain is because of muscle spasming or muscles pulling in a direction that they're not used to being pulled, or more work being put on the muscles than when a woman's not pregnant, because of all the the extra weight, the extra mass that's there. But yeah, as long as a person is working with somebody who's qualified, who's worked with who has good experience with pregnant women, I have no problem with that at all. In fact, it's probably helpful. Okay. All right, and that does. Oh wait, okay. Actually, the one just came out. So sudden. Let me see this. This is something. Sudden total hearing loss happened to me 2 years ago, and I gather that something similar recently happened to Paul Simon. Let's hope you will raise the profile on this syndrome. Sometimes the ear can be saved, but only with prompt, knowledgeable medical attention. Why aren't people taught that sudden total hearing loss is either in the ear, in either ear, is an emergency for that ear? Well, I can't speak as to why that is not being taught in the first place, but obviously, and I would think that most people, if they had a sudden hearing loss, that's pretty dramatic. And I would, if that happened to me, that would be an emergency under any circumstance to me, that I would want to be seeking emergency help. We know that there, could there be some level of inflammation? We know that there could be post-viral syndromes. I wouldn't be surprised if this was one of the things that was part of a long COVID type of situation, because inflammation can cause inflammation of those nerves, etc. So certainly for anybody out there, if there is a sudden hearing loss and it's a total hearing loss, that I mean, that should raise some flags and go for and be promptly seen, because yes, of course, if there is inflammation and there's damage and there's scarring of the nerves, that could be irreversible. So anything that can be done to try to figure out why it's happening, to try to reverse it, that could be very helpful. Obviously, you know, if a person has total loss, I don't know that how much a hearing aid would help them at that point. Maybe, again, working with an audiologist and an ENT, because maybe there's need for cochlear implants. Of course, there's different types of tests that audiologists can do to see. But I wouldn't be sticking around for too long with that. If that happened to me the next day, I would be evaluated. I don't know if it needs to happen that night. If it was maybe, probably if it happened to me, that would be alarming and I would get seen at night. But yeah, we shouldn't be letting something as dramatic as that seeing if it would go away on its own. I would be kind of fast with that. Okay. So that's all the questions that we have for today. I know that we've been kind of that the questions have been coming closer to 30 minutes. I know earlier on doing this that we were getting more like 60-minute out of this. So we kind of decided we're going to try to keep things around 30 so that we're able to answer these questions in a succinct way. Please join us next month. You can watch prior months if you haven't seen prior videos. This one will be posted on the YouTube channel. Previous ones are there. If you haven't seen them, you want to see what we were talking about on that day. We always tend to go in different directions. That's what makes this time fun, because I get to really think on my toes and to be able to come up with something very quickly. So of course, if you haven't subscribed to this YouTube channel, please do so. We really want to get our numbers up. That's what helps us out on the algorithm, so other people can see this information that I know that you appreciate, because you probably wouldn't be here otherwise. But also, since we're going to be doing this in 30-minute increments from now on, get your questions in sooner as opposed to later. Okay, that should be very helpful there. And again, as I mentioned, following us on TikTok, as I said before, the other ways of getting a hold of us. Please join us on our Patreon if you want to be a supporter of what we do. That's one of the ways that we're able to pay for our tech people in order to put these types of things on. So so please to join us in any way. Thank you so much for listening, and please share this information. Tell other people to subscribe to our different social media platforms as well, because we really want to get the word out there. It does seem, and I do get so much feedback, that the approach that we're taking is it's an appreciated but not well known thing. So we all can help in spreading the word. Have a great day.